Vagus nerve as modulator of the brain-gut axis in psychiatric and inflammatory disorders. This was published in Frontiers in Psychology. It was published online March 13th, 2018 in the National Library of Medicine, National Institute of Health. Vagus related, this is part 3. Vagus related treatment for depression. Basic pathophysiology of depression. Major depressive disorder ranks among the leading mental health causes of the global burden of disease, with a lifetime prevalence of 1% in the Czech Republic to 16.9% in the U.S. The cost of the depression poses a significant economic burden to our society. The pathophysiology of depression is complex and includes social and environmental stress factors, genetic and biological processes such as the overdrive of the HPA axis, inflammation, and disturbances in monoamine neurotransmission as described above. For example, a lack of the amino acid tryptophan, which is a precursor to serotonin, can induce depressive symptoms such as depressed mood, sadness, and hopelessness. The overdrive of the HPA axis is most consistently seen in subjects with more severe, example, melancholic or psychotic depression, when the cortisol feedback inhibitory mechanisms are impaired, contributing to cytokine oversecretion, and it's been shown that chronic exposure to elevated inflammatory cytokines can lead to depression. This might be explained by the fact that cytokine overexpression leads to the reduction of serotonin levels. In line with that, the treatment with anti-inflammatory agents has the potential to reduce depressive symptoms. In line, IBD are an important risk factor for mood and anxiety disorders, and these psychiatric conditions increase the risk of exacerbation of IBD. Vagal nerve stimulation in depression. A European multi-center study demonstrated a positive effect of VNS on depressive symptoms in patients with treatment-resistant depression. The application of VNS over a period of 3 months resulted in a response rate of 37% and a remission rate of 17%. After 1 year of treatment, the response rate reached 53% and the remission rate reached 33%. A meta-analysis that compared the application of VNS to the usual treatment in depressed patients showed a response rate of approximately 50% in the acute phase of the disease and a long-term remission rate of 20% after 2 years of treatment. Several other studies also demonstrated an increasingly long-term benefit of VNS in recurrent treatment-resistant depression. Further, a 5-year prospective observational study which compared the effects of treatment as usual and VNS as adjunctive treatment with treatment as usual only in treatment-resistant depression showed a better clinical outcome and a higher remission rate in the VNS group. This was even the case in patients with comorbid depression and anxiety who were frequent non-responders in trials on antidepressant drugs. It's important to note that all of these studies were open label and did not use a randomized placebo-controlled study design. Patients with depression have elevated plasma and cerebrospinal fluid concentrations of pro-inflammatory cytokines. The benefit of VNS in depression might be due to the inhibitory action of the production of pro-inflammatory cytokines and marked peripheral increases in anti-inflammatory circulating cytokines. Further improvements in VNS was associated with altered secretion of CRH, thus preventing the overdrive the HPA axis. Altered CRH production and secretion might result from a direct and stimulatory effect transmitted from the vagus nerve through the NTS to the paraventricular nucleus of the hypothalamus. Finally, VNS has been shown to inhibit peripheral blood production of TNF-A, which is increased in clinical depression. The influence of nutrition depressive symptoms. The gut microbiota is the potential key modulator of the immune and the nervous systems. Targeting it could lead to greater improvement in the emotional symptoms of patients suffering from depression or anxiety. There's growing evidence that nutritional components such as probiotics, gluten, as well as drugs, and such as antioxidative agents and antibiotics have a high impact on vagus nerve activity through the interaction with the gut microbiota, and that this effect varies greatly between individuals. Indeed, animal studies have proved evidence that microbiota communication with the brain involves the vagus nerve, and this interaction can lead to mediating effects on the brain and subsequent behavior. For example, lactobacillus species have received tremendous attention due to their use as probiotics and their health-promoting properties. Bravo and others demonstrated that chronic treatment of mice with Lactobacillus rhamnosus strain B1 caused a reduction in stress-induced corticosterone levels and in anxiety-like and depression-like behavior. It's been shown that chronic treatment with L. rhamnosus induced region-dependent alterations in GABA, or mRNA in the brain, with increases in cortical regions, cingulate and prelimbic, and concomitant reductions in expression in the hippocampus, amygdala, and LC. In addition, L. rhamnosus reduced GABA mRNA expression in the prefrontal cortex and amygdala, but increased GABA in the hippocampus, which counters the typical pathogenesis of depressive symptoms. Lack of prefrontal control and overactivity of subcortical axogenic brain regions, importantly, are rhamnosus, reduced stress-induced corticosterone, and anxiety and depression-related behavior. This is not surprising since alterations in the central GABA receptor expression are implicated in the pathogenesis of anxiety and depression. The antidepressive and anxiolytic effects of L. rhamnosus were not observed in vagonomized mice, identifying the vagus as a major modulatory constitutive communication pathway between the bacteria exposed to the gut and the brain. In line with that, in a model of chronic colitis associated with anxiety-like behavior, the anxiolytic effect obtained with the treatment with Bifidobacterium longum was absent in mice that were vagonomized before the induction of colitis. In humans, psychobiotics, a class of probiotics with anti-inflammatory effects, might be useful to treat patients with psychiatric disorders due to their antidepressive and anxiolytic effects. Differences in the composition of the gut microbiota in patients with depression compared with healthy individuals has been demonstrated. Importantly, the fecal samples pooled from 5 patients with depression transferred into germ-free mice resulted in depressive-like behavior. Influence of relaxation techniques on depressive symptoms. It's been shown that self-generated positive emotions via loving-kindness meditation lead to an increase in positive emotions relative to the control group. An effect moderated by baseline vagal tone. In turn, increased positive emotions produced increases in vagal tone, which is probably mediated by increased perceptions of social connections. Individuals suffering from depression, anxiety, and chronic pain have benefited from regular mindfulness meditation training and demonstrating a remarkable improvement in symptom severity. Controlled studies have found yoga-based interventions to be effective in treating depression ranging from mild depressive symptoms to major depressive disorders. Some yoga practices can directly stimulate the vagus nerve by increasing the vagal tone, leading to an improvement of autonomic regulation, cognitive functions, and mood and stress coping. The proposed neurophysiological mechanisms for the success of yoga-based therapies in alleviating depressive symptoms suggest that yoga breathing induces increased vagal tone. Many studies demonstrate the effects of yoga breathing on brain function and physiologic parameters. Thus, Sudarshan Kriya Yoga, a breathing-based meditative technique, stimulates the vagus nerve and exerts numerous autonomic effects, including changes in heart rate, improved cognition, and improved bowel function. During SKY, a sequence of breathing techniques of different frequencies, intensities, lengths, and with end inspiratory and end expiratory holds, creates varied stimuli from various visceral afferents, sensory receptors, and baroreceptors. These probably influence diverse vagal fibers, which in turn induce physiologic changes in organs and influence the limbic system. A recent study showed that even patients who did not respond to antidepressants showed a significant reduction of depressive and anxiety symptoms compared to the control group after receiving an adjunctive intervention with Sky for 8 weeks. Iyengar yoga has been shown to decrease depressive symptoms in subjects with depression, and Iyengar yoga is associated with increased heart rate variability, supporting the hypothesis that yoga, breathing, and postures work in part by increasing parasympathetic tone.